Hi, I am Dr. Viduvarsha. Today we will discuss about rotavirus vaccination. So if they ask this question in your university exam, you start with an introduction. In introduction, you jot down some epidemiological points. It is a leading cause of severe dehydrating diarrhea in children less than 5 years of age. Second, in India, diarrhea accounts for less than 10% of or it accounts for 10%. It accounts for 10% of under 5 mortality. Globally, there are 4 main pathogens responsible for causing diarrhea. These are: first, it is rotavirus. Next, it is cryptosporidium. Third, it is enterotoxigenic E. coli. Fourth, it is Shigella. Next, this is about the introduction. Next, we will talk about the pathogen. Rotavirus is an RNA virus. It consists of 7 serogroups, that is from A to G. It consists of viral outer capsid protein named as VP7 and VP4. This VP7 encodes G serotype and VP4 encodes P serotype. So among the group, that is 7 serogroups, group A is the most common cause of human disease. Next, among this outer capsid protein and the serotypes, G and P serotypes, it is G1P8, which is most prevalent in India. Sixth point, transmission. Transmission is mainly by person-to-person contact. Rather than by poor hygienic condition, it is mainly by person-to-person contact. Then it can also transmitted by fecal-oral route and also through fomites. Okay. Seventh is immunity. So how is the immunity being generated when you get a rotavirus infection? Immunity is triggered by both humoral and cellular components or cell-mediated immunity. So these are the 7 points you have to write regarding the pathogen. Next, we will come to the question proper. It is vaccines. So here these are oral live vaccines. I'll tell you in the beginning. So first, it is RV1. It is a human monovalent rotavirus vaccine. Second, RV5. It is a pentavalent human and bovine reassortment rotavirus vaccine. Next, it is 116E. It is an Indian neonatal rotavirus live vaccine. This is being used in the universal immunization program, and this is also a human bovine reassortment vaccine. Fourth, it is bovine rotavirus pentavalent vaccine. So it is bovine rotavirus pentavalent vaccine. Now let's see the names of this, the trade name. This is Rotarix. This is Rotatec. That is RV5 is Rotatec. What we use in our program, that is 116E, is Rotavac. And bovine rotavirus pentavalent vaccine is Rotacil. We will see about each vaccine in detail and also their comparison. RV5, 116E and bovine rotavirus vaccine pentavalent. So first, what is the strain that is used in RV1? So as the name suggests, it is a monovalent human rotavirus vaccine. So the strain here is only one strain, that is G1P1A8. Dose is 1 ml. It is found in lyophilized powder form. So since it is in a lyophilized powder form, it needs a reconstituent. So the reconstituent used here is sterile water with calcium carbonate and with xanthan. So what is the dose used here? Is each 1 ml consists of 10 to the power of 6 median culture infective units. It is median culture infective unit. There is no preservative in this. It is stored in 2 to 8 degrees Celsius. It is given as 2 doses at 6 and 10 weeks. So this is about RV1, that is human monovalent rotavirus vaccine. Next is RV5. So as the name suggests, it is a pentavac. So from the human strain, it consists of G1, G2, G3, G4 and P1A8. This is human. Next, from bovine strain, it consists of WC23. It is found in a liquid formulation. So since it is in a liquid formulation, there is no need for reconstituent. So the dose here is, sorry, I forgot the dose. Dose here used is 2 ml. So each 2 ml consists of 2 into 10 to the power of 6 infectious unit of each strain. In here also there is no preservative. This can be stored in 2 to 8 degrees Celsius. There are 3 doses, that is at 6, 10 and 14 weeks. This is about RV5. Next is Rotavac, that is 116E. That is Indian neonatal rotavirus live vaccine. It is a bovine, this is also a bovine human reassortment strain that is characterized by G9P11 with VP4 as this is the bovine strain. They have other strains are from human. The dose used here is 0.5 ml. I'll write the dose in different color. Dose here is 0.5 ml. This is also found in liquid formulation. So there is no reconstituent in this. So the dose 0.5 ml consists of not less than, that is NLT, not less than, correct, NLT, this is not less than 10 to the power of 5 focus forming units. FFU is focus forming units of each strain. Here also there is no preservative used. This can be stored at 2 to 8 degrees Celsius for up to 6 months. 2 to 8 degrees Celsius in 6 months, and it can be stored at minus 20 degrees Celsius till the expiry date. This is all not required. Just remember 2 to 8 degrees Celsius. This is also given in 3 doses at 6, 10 and 14 weeks. Next is bovine rotavirus vaccine pentavalent. As the name suggests, it's a pentavac. So all the 5 are from bovine thing. That is, it is G1, G2, G3, G4 and G9. Okay. This is a freeze dried vaccine. The dose here is 2.5 ml. Okay. So each 2.5 ml consists of not less than 10 to the power of 5.6. This is 10 to the power of 5.6. I'll write it clearly. It is 10 to the power of 5.6 focus forming units. Okay. There is no preservative here. This is also stored at the Celsius of 2 to 8 degree. 3 doses at 6, 10 and 14 weeks. Okay. The diluent here is citrate bicarbonate buffer solution. Citrate bicarb buffer solution. Also it contains sucrose, glycine and glutamate here in this diluent. So no need to have that much in your mind. So this is enough for the vaccines. That is RV1 is G1 P1A8, RV5 is human with bovine. Human consists of G1 to G4 and P1A8. Bovine it is WC23. In this Rotavac it is G9 P11 with VP4 as bovine strain. And this bovine rotavirus pentavac it is G1, G2, G3, G4 and G9. Doses are 1 ml, 2 ml and 0.5 ml and 2.5 ml. First RV1 is lyophilized powder, RV5 and this Rotavac. These two are liquid formulation, other two are freeze dried vaccines. So therefore the reconstituents are present for RV1 and for the bovine rotavirus pentavac vaccine. The doses it contains, that 1 ml contains 10 to the power of 6, 2 ml contains 2 into 10 to the power of 6, 0.5 ml contains 10 to the power of 5, 2.5 ml contains 10 to the power of 5.6. Okay. So everything is stored in 2 to 8 degrees Celsius. Everything are 3 doses except for this RV1. It is a 2 dose at 6 and 10 weeks of age. Okay. Next we will see about the vaccine schedule and their immunogenicity. Okay. So what is the UIP schedule? So UIP schedule is Rotavac, which is given at 6, 10 and 14 weeks of age. So minimum age for giving this is at 6 weeks. Maximum upper age limit for the first dose is 1 year of age. If the child gets a vaccine, first vaccine at 1 year of age or at the 12 months of age, she or he can be given the next 2 doses at 4 weeks interval. This is according to UIP schedule. According to IAP schedule, this is at 6, 10 and 14 weeks. Maximum upper age limit for first dose is 14 weeks and 6 days. Maximum upper age limit for last dose is 8 months and 6 days. Beyond this, you can't give the rotavirus vaccination. Next, what are the immunogenicity? The efficacy of the vaccine was not studied in India. So immunogenicity is RV1 and RV5. RV1 has 60% and RV5 have 85%. This Rotavac has an efficacy of around 55%. This is efficacy. Okay, if you can remember these numbers. Okay. Next, interchangeability. Whether the vaccines can be interchanged. So the vaccine series should be completely with the same product. It should be with the same product. It cannot be interchanged. If anyone gets a dose of RV5 or what the dose is unknown, you have to repeat all the 3 doses. They should not be denied of getting vaccination. Okay. Next is, if the child regurgitates, what will you do? There is no need to repeat the vaccination once again. You can continue with the 3-dose series. Okay. So re-administration need not be done in any infant who regurgitates, spits or vomits during or after the administration. Okay. Next is the contraindications. So what are the contraindications? First, when the patient or the child is allergic to any component of the vaccine. Second, when there was an allergic reactions in previous immunization or previous vaccination. Third, severe combined immunodeficiency. Fourth, RV1. This is contraindicated in child with latex allergy since it contains latex rubber in it. Fifth, if the mother have received any biological response modifier in her pregnancy. If mother have received biologic response modifier in her or during her pregnancy. So these are the contraindications. Okay. This is the contraindication in which this rotavirus vaccine should not be provided. What are the conditions? Precautionary conditions. So you can provide vaccine, but you should be precautious. In which all condition you should be precautious? First, when they have altered immunocompetence. Second, when they have moderate to severe gastroenteritis. Third, when they have pre-existing chronic GI disease. Okay, so these are the conditions in which you should be precautious. So that is about another one absolute contraindication I forgot. That is if the child has a past history of intussusception. Is also an absolute contraindication for rotavirus vaccine administration. Okay, so this is about the rotavirus vaccination in short. Thank you.